Welcome back. Acne vulgaris is a common human skin disease where you can find areas in the skin that are scaly, that are reddish, black heads and white heads sometimes on some parts of the skin, pinheads, sometimes pimples can appear also, and it wouldn't look really amicable to people whom you are communicated with. And acne also affects mostly the skin who are occupying densely populated areas. When there is a lot of crowd, when there isn't enough fresh air, I guess, or the doctor can correct me, or if the hygiene in rooms or in the climate is not really the perfect one to be for a human being to live. That is where you can find the acne vulgaris. It's one terrible skin disease that we need to find a cure for, and we're delighted to have with us Dr. Munir William, who is going to, as usual, give us his very valuable tips on how to avoid the acne vulgaris. He's a plastic surgeon, of course.
Yes.
Good morning, doctor.
Good morning. Yes.
So, doctor, could you tell us ways of avoiding, could you first tell us the types and how it comes to, because we know that some adolescents, they go through it naturally and it fades away. But what about when it doesn't fade away, or when it comes at an older age? How can one avoid that?
Okay, let's start to speak about acne. What is acne? Acne is just inflammation of the sebaceous skin, which is present in the face, or upper part of the chest, or upper part of the back. It is acute or chronic infection of these sebaceous glands. This, of course, occurs at certain periods, 3 periods. The most commonly it occurs during puberty, due to many causes. But sometimes we find the acne rash present during a stillbirth or child who is infant, neonate, because it is due to hormonal supply from his mother. And also there is acne can be found in certain types or certain women in postmenopausal period due to hormonal change also. As for acne, and as you asked about causes of acne, there are many causes. There may be hereditary causes, because some families have acne, and some families has scars related to acne, and so on. There's another cause which is due to infection by subtype of anaerobic bacteria. Certain type related to nutrition. We find persons who are taking fast oil, this oil in their fat, in their food, also they are affected by acne. Also, as you said, there is a reason related to increased temperature in the atmosphere or increased humidity in the atmosphere. Also, we can find certain types of acne related to use of certain drugs, or even certain types of plastic creams or ointments. There is certain types of acne here present also. All these causes together, and also drugs related as contraceptive pills or drugs as corticosteroids and so on, all these reasons together help to formation of acne. As for types of acne, as you said in the start, there are 2 types of acne or papules. There is white papules, in which we find the acne is present below the skin, and the superficial layer of skin, which is epidermis, is intact, and therefore it is white in color, and they are called white comedones. But there is black comedones, in which we find the superficial layer of skin is ruptured, and there is formation of black substance, which is melanin, and this leads to the formation of black heads of these types of acne. So there are 2 types, whether they are white type, which is white papules, or black types, which is black papules. These are the 2 types of acne.
Right. The cure.
Yes, as for the line of cure,
there must be something to do having all those problems on one skin.
Of course, the first line of treatment is the prophylactic line of treatment. This is related to our nutrition, our food. We have to decrease the amount of oil in our food, of fats in our food. Of course, fast food plays an important role in to reduce these amounts of food. This is the prophylactic line. As for the treatment, this treatment passes in many lines. First line is medical treatment. The medical treatment is just either by systemic, by taking certain types of antibiotics, or local for the acne, related to local application of creams, ointments, or lotions, and so on. This is the first line of treatment, which is the medical treatment. Second line of treatment related to peeling. Peeling means elevation or trying to get rid of the superficial layer, superficial inflamed layer of the skin. And this occurs either by two materials, either what is known as TCA, which is trichloroacetic acid, in different concentrations, starting from 1% up to 20 or 30, even 30%.
20 isn't too much?
For certain types of skin types, which is, as we said, for white skin type, we can use up to 30%. But for black skinned, we can use from 5 to 10% maximally. And also there is peeling by certain another material, which is glycolic acid. Peeling by glycolic acid is more recent type of peeling and less harmful to the skin. This is the second line of treatment. This is the line of peeling. First one is medical, second line is peeling, third line is laser. Laser by certain types, many types of laser can use. The idea for laser is to get rid of the anaerobic bacteria which are present behind the skin. And only laser can get rid of these anaerobic bacteria which are present below the skin. We can use different types of lasers, such as carbon dioxide laser can be used, IBL, which is intensive pulsed light, can be used, and also we can use what is known as fraxil laser for treatment of scars which are left after acne, post-acne scars. As for the fourth line of treatment is the role of plastic surgery. Plastic surgery can play a role in treatment of acne in two ways. Either by small soft operation called dermabrasion, in which we remove the superficial layer of the skin, or another operation which is fat injection, in which we take fat from certain parts of the body and re-inject in the face to get rid of the small scars which are present following acne. These are the most four lines for treatment of acne, but from my own opinion, prophylaxis is better than treatment. We have to prophylact in our nutrients, we have to protect in skin cleansing by certain different types of the skin, and so on. This is the most important line for my own opinion.
Right, Dr. Munir William, the plastic surgeon. I'd like to thank you very much for those as usual valuable tips. Thank you very much for coming, and I guess this is where we end this edition of the Breakfast Show. Many thanks to you, Rahma, for
Thank you, dear, as always.
And please join us tomorrow morning with another new team. Until then, that's a goodbye.